Om Shri Dhanvantaraya Namaha. A warm good morning to all. Myself, Dr. Suhasini Eldandagi, Assistant Professor, Department of Kaya Chikitsa, Grameen Ayurvedic Medical College, Terdal. I welcome you all on behalf of Shri Bahubali Vidyapeeth's Jeenasenacharya's Grameen Ayurvedic Medical College, Terdal, Bagalkot, Karnataka, who has clubbed all of us for the national webinar PRANA-TANTRIKA 2021. Prayer is talking to God Almighty, the creator of whole universe. So let's start this webinar with presence of God. I request our staff to grace this occasion with Dhanvantari prayer.
Om Namah Dhanvantari Adidevo Surasura Vandite Padapadmam Loke Jaramabhayam Vinashanam Dhataramishram Vidaushadinam Dhanvantari Ramanatham Sarvaroga Nivarakam Ayurveda Prabhakaram Vande Piyushadayakam Sarve Jana Sukhino Bhavantu Sarve Santu Niramaya Sarve Bhadrani Pashyantu Ma Kashchid Dukha Bhave Om Shanti Shanti Shanti.
Thank you, everyone. Now I request Dr. Ushakala Patil, Madam, Associate Professor and HOD, Department of Shareera Rachana, and the Organizing Secretary of this webinar. I welcome you, Madam, for the welcome speech.
Om Namah Siddhebhyaha, Om Namah Siddhebhyaha, Om Namah Siddhebhyaha. उत्साहात निश्चयात धैर्यात तत्तत् कर्म प्रवर्तनात संग त्यागो सतो वृत्ते षड्भिर भक्ति प्रसिद्ध्यते. These are the steps of success mentioned in Bhagavad Gita. Success is not a key to happiness, but happiness is a key to success. If you love what you are doing, you will be successful. Hello, good morning, everyone. All we know, the deadly and infectious disease COVID-19 has deeply affected not only global economy but also shaken up the global education sector. This pandemic forced all schools and colleges to remain closed for longer time. So, educational units are struggling to find options to deal with this challenging situation. By keeping this in mind, we Bahubali Vidyapeeth's Mandal's Grameen Ayurvedic Medical College Terdal organizing the national webinar PRANA-TANTRIKA 2021, which is focused on respiratory system and nervous system by the Department of Shareera. So, on this occasion, it gives me a great pleasure to welcome all of you present here. All-round development and improvement of the institute depends upon the management. So first, I sincerely welcome to all the management of our college and chief patron of the webinar. I would like to welcome Shri D.C. Patil sir, chairman of the Grameen Ayurvedic Medical College Terdal. Welcome, sir. Next, I would like to welcome Dr. J.B. Algur sir, Secretary of Grameen Ayurvedic Medical College, Terdal. Welcome, sir. Then I would like to welcome Sri Nilesh Desai sir, Treasurer of Grameen Ayurvedic Medical College, Terdal. Welcome, sir. Great honor that our webinar will be inaugurated very soon by an eminent personality, Dr. P.N. Rao sir, Principal, SDM College of Ayurveda, Hassan. So, I would like to heartily welcome Dr. P.N. Rao sir. Welcome, sir. Now, I warmly welcome to the silent but luminous personality in the field of Ayurveda and resource person of today's session, Dr. Shankarlinga Maidargi, Associate Professor, Department of Shareera Rachana, SVM Ayurvedic Medical College, Ilkal. Welcome, sir. Next, I would like to welcome Principal of our college and President of the webinar, Dr. L.M. Biradar, sir. Welcome, sir. Next, I would like to welcome all the teaching, non-teaching staff and hospital staff and students of our college. Next, I extend my welcome to all the PG scholars, UG students of different colleges and audience across the different parts of the country and all the media persons. So welcome, welcome one and all. Thank you.
Thank you, madam, for your warm welcome speech. Before the inaugural speech, I would like to draw your attention to introduce Dr. Prasanna Rao, sir. Sir was born in 1961 in a small agriculture family of Beltangadi Taluk, Dakshina Kannada district of Karnataka. Sir completed BMS from Mangalore University, post-graduation degree in Shalyatantra and PhD both from Banaras Hindu University, and served as a clinical registrar and then senior resident in Department of Shalyatantra, Faculty of Ayurveda, AT Banaras Hindu University. During this time, Sir performed over 600 general surgeries and many more anorectal surgeries. Later, Sir joined in Sri Dharmasthala Manjunatheshwara College of Ayurveda and Hospital Hassan and served in various cadre and presently serving as professor and head of the institution. Over the period of 2 decades, Sir built team of faculty imparting quality Ayurveda education and hands-on training to students across the country and abroad. Sir is involved in development of academic activities of Rajiv Gandhi University of Health Science, Karnataka, right from inception in various capacities like member, faculty, board of studies, academic council, senate, syndicate, chairman, PhD committee, and local inspection committees. Sir was worked as member of Executive Council in CCIM. As a member of High Level Committee, Sir recommended Ayurveda, Siddha, Unani doctors under NRHM and other national health programs for strengthening national health service. Sir was member of peer team in NABH and served as a member in various universities of Karnataka, Kerala, Gujarat in Academic Council, Examination Committee and Syllabus Committee. Sir is a editor, advisor, peer reviewer, executive member of national and international research journals, publications. For his great service in Ayurveda and healthcare system, Sir has been recognized and facilitated with many awards like Sushruta Ratna, Aksharabhisheka Award, Dhanvantari Award, Ayurveda Chanakya, Award of Vocational Excellence, and recently Sir awarded with Professor Emeritus by Rajiv Gandhi University, Bangalore. With this short introduction, now I request today's inaugurator and chief guest Dr. Prasanna Rao sir to inaugurate today's session. With watering the plant, I request Dr. Prasanna sir to inaugurate the function. Over to you, sir.
Thank you, Dr. Grameen Ayurveda Medical College. Will inaugurate by pouring holy water to Tulsi and lighting the lamp. We have Dr. Uma Gopal, the head of the Department of Rachana. Dr. Prasanna, yes. Dr. Shobha Gowda. Dr. Simi Prabhakar. Dr. Mutibanas. Yes, madam.
Thank you, sir.
Sir, audible proceed. Audible proceed. Sir, can audible proceed for the
Sir, is it audible? It's sir, you can proceed, sir.
Is it audible?
Yes, sir.
Yes.
It's audible, you can proceed, sir. Okay, sir.
Yeah. Jai Jeenendra, Om Shri Manjunatha Namaha, Om Dhanvantare Namaha. Most respected, the trustees of Grameen Ayurveda Medical College, Terdal, Honorable Principal Dr. Biradar, and all our friends,
Yes, sir.
faculty of Ayurveda of Grameen Ayurveda Medical College, and all resource persons. I'm very happy that this 5 days program on PRANA-TANTRIKA is a unique program which is organized by Grameen Ayurveda Medical College. First, I would like to congratulate and compliment all the faculty who are involved in this novel program. Ayurveda as well, the India, is always now in sharing the knowledge. We always feel proud and also feel happy to share the knowledge. And as is already mentioned, COVID-19 has taught us rather reach each with the webinars. Webinar is one of the mode through which we share the knowledge where the participants are in their own place, which saves enough time of the participants, which saves the economy, money of the participant as well the organizers. This is what we have gained during COVID-19. We were spending a lot of time, money in organizing such seminars, but fortunately, due to COVID-19, the money is saved, time is saved, and knowledge is shared to many. Everyone find difficult to participate in the seminar which is organized, but in the webinar they can take part in the these programs wherever they are. So this is one of the benefit which we got through COVID-19. Rajiv Gandhi University of Health Sciences has continuously encouraging Ayurveda educational institutions to promote Ayurveda knowledge with various modes. I'm happy to bring all the knowledge of the educationalists that Rajiv Gandhi University even financially support for the colleges, for the departments which organize the seminars and hands-on training programs, and institutions too. So both undergraduate level departments and postgraduate level departments. Today, I'm very happy that the knowledge of structural anatomy is being shared in the name of PRANA-TANTRIKA, and this COVID-19 affects its target is the respiratory system. As well, the later stage, it is found that all sense organs are affected, even the brain is affected, bone is affected, GIT is affected, rather all vital organs are affected. We know that the prana exists in all these vital organ. You may call it as shiras, or it may call it as hridaya or basti, the three marmas, and kanta, rakta, shukra, ojas, guda, and the shanka marma, which is exist in the shiras. So all these are the seeds of prana, what we consider. And among all the prana, mukhya prana is the vayu. Among mukhya prana also, udhana vayu is considered as vayu uttama or prana uttama. So the vata which is inward, right? Maybe pranavata or udana vata, which has role in healthy status, as well as when it is affected by COVID-19, and these two vayu are much affected. So our concern is to know first, whatever building you build, the foundation is very important. Once foundation is strong, then whatever height you can build. Same way, the knowledge also, the medical knowledge. Medical knowledge is based on our structures. The structure in sense, the structural anatomy. But different to the biomedical science, the Ayurveda has gone step forward, and Ayurveda always considered the functional anatomy. It has given more importance to the functional anatomy than the structural anatomy. And these discussions are more about the clinical anatomy. And whatever anatomy or physiology, the knowledge of Shareera, right? Shareera, which comprise both, in the name of modern name of anatomy or physiology. I remember Dr. Vishweshwar Reddy, who was the former registrar evaluation of Rajiv Gandhi University of Health Sciences, and he was always used to quote, Ayurveda students should know more about the functional anatomy or physiological anatomy. So wherever you see the basic informations of Shareera in Sushruta Samhita, Sushruta has given more importance for physiological anatomy. So it may be regional. Right now, an example of when throat or nasal sinuses are affected, or later the trachea or bronchioles or alveoli are infected, right? And all these we see the functions, regional anatomy, right? And when we treat the patient also, a basic surgeon or physician should know about the regional anatomy, which will help them to apply their clinical skills. So clinical skill only are not enough, right? Clinical skills should have go parallelly with the knowledge of anatomy and physiology. I always remember when I used to teach Shareera, right? I used to give more importance for the functional anatomy, and an example, the muscles of facial expressions. You know, these days the break dance are very common. We name in the different dances. They move different muscles. They move the different regions, right? And these muscles are more made prominent, so that we know that which muscle we are using for particular action. And the latest addition for the management of COVID-19, which is always said, is the patient should be in the prone position to have a more oxygen concentration. So here also, right, more area of alveoli will be exposed when we are in the prone position. So these should be taught for the present day students in the name of clinical anatomy or applied anatomy or functional anatomy. Ultimately, the would-be doctors should have knowledge. Always we should think that why we need to study anatomy when you become a doctor, or why you should study about physiology. Ayurveda is always has the belief of uh, tantras, and these tantras has taught us, right, to have a balance among three doshas. Ultimate aim of an Ayurveda physician is bringing a balance between three doshas. Dhatu samya kriya prokta tantras asya prayojana. So all tantras, right, you call it PRANA-TANTRA or Sushruta-TANTRA or Charaka-TANTRA, whatever tantras, ultimate aim of these tantras is to have bring balance among tridoshas. Ayurveda believes on this, not with the present relation with whatever the chemical changes which happen in the body. The chemical changes will happen when dosha deranges. So samyata and asamyata, that knowledge we need to have through this webinar. I am sure that the resource person which are being selected by the organizers are really wonderful, and the topics which is selected also are very useful. And these days students, most of the students, right, they sit at home and in their sukhasanas and learning in sukhasanas, right, the grasping power will increase. And fortunately COVID-19 has given us this opportunity to learn wherever whatever position we are, whether bhukta or abhukta, right? All opportunities we have got it. So I'm really happy today to participate in this webinar and inaugurate this webinar. I declare that the webinar on Tantrika for these 5 days is been inaugurated by blessing of Lord Bahubali. Wish you all the best. I am once again congratulate the all organizing committee members of this webinar, right, to reaching each of Ayurveda students. Means Ayurveda students means a teacher also a student of Ayurveda, and it is not necessary that they are graduates of Ayurveda. All lovers of Ayurveda will have knowledge of Ayurveda. I'm sure this all recorded video will be available in the YouTube for the benefit of many, so that Terdal will reach a whole globe through this webinar. Wish you all the success. Thank you very much.
Thank you very much, sir, for your mesmerizing words. Now, I request our beloved principal, Dr. L.M. Biradar, sir, Professor and HOD, Department of Panchakarma, for keynote address. Over to you, sir.
Good morning to all. Om Dhanvantraya Namaha. Honorable Chairman Sir of this esteemed institute, Shri D.C. Patil Sir. Dynamic driving force behind us, Secretary of Grameen Ayurvedic Medical College, Dr. J.B. Algur Sir. Enthusiastic social worker and treasurer of Grameen Ayurvedic Medical College, Shri Nilesh Desai Sir. Professor Emeritus of Rajiv Gandhi University, Principal of SDM Ayurvedic Medical College, Hassan, Dr. Prasanna Rao Sir. Organizing Secretary of this webinar, Associate Professor and HOD of Anatomy Department of our college, Dr. Ushakala Patil Madam, coordinators, teaching and non-teaching staff of Grameen Ayurvedic Medical College, and my lovely students and audience of this webinar. So as PRANA-TANTRIKA 2021, a national webinar on respiratory system and nervous system organized by Department of Rachana, Shareera, Grameen Ayurvedic Medical College, Terdal, in a preview from 9th July to 12th July 2021, the eminent Ayurvedic research scholars and of Rachana Shareera participating as a resource persons and sharing their bestowed knowledge with Ayurveda students and teachers in this webinar. And as on day first, Dr. Shankarling Maidirige, Associate Professor, Department of Rachana Shareera from SVM Ayurvedic Medical College and Hospital, Ilkal, is sharing on topic anatomy of upper respiratory tract and applied aspect of clinical anatomy, sharing their views on this topic. On second day, Dr. Girish Kulkarni, Professor and HOD, Department of Rachana Shareera, Ayurveda Mahavidyalaya, Suntibai Shah Ayurvedic Mahavidyalaya, Pune, sharing their view on anatomy of lower respiratory tract and clinical anatomy. And on third day, Dr. Mantesh Ramanor sir as a chief guest on third day, and Dr. Pramod Budru, Principal Professor and HOD Department of Shareera Rachana, Sri J.J. Magdum Ayurvedic Medical College, are sharing on the topic understanding of respiratory system in Ayurveda. And on fourth day, Dr. Srinivas Banigol sir, Dean Ayush RGHS Bangalore and Principal of Sanjeevani Ayurvedic Medical College, Hubballi, as a chief guest for the inaugural session. And Dr. B.G. Kulkarni sir, Principal, Parul Ayurveda Institute, Vadodara Parul, so are also as a chief guest on this day. And speaker will be Dr. Gurraj Jagirdar, Professor and HOD, Department of Shareera Rachana, SDM Institute of Ayurveda, Bangalore, sharing on the topic a brief practical approach of structures of nervous system. So in this 4 days webinar, so I am very much thankful to Dr. Prasanna Rao sir for the good initiation for us with the blessings of Lord Dhanvantri as a guru of all of us in the field of Ayurveda. And I also thankful to our organizing team of Grameen Ayurvedic Medical College. And I am also very much thankful to our management for providing a good opportunity to share our knowledges. And with this, I conclude my words. Thank you one and all for giving me an opportunity. Thank you.
Thank you, sir, for your great, graceful speech. Now, let's begin the first session on anatomy of upper respiratory tract and its clinical anatomy. So, I request Dr. Shrikant, sir, to introduce our today's guest speaker. Over to you, sir.
Good morning, everyone. A warm welcome to all PRANA-TANTRIKA 2021. I'm happy to introduce Dr. Shankarling B. Maidargi sir. Sir was born on 30 December 1983. Sir completed his BMS from SVM Ayurvedic Medical College, Ilkar, and post-graduated in Rachana Shareera from NK Jabshetty Ayurvedic Medical College, Bidar. Sir is a PhD registered scholar at Parul University of Health Sciences, Gujarat. Sir has been actively participating in national seminars, workshops, and conferences. Some of them are paper presentation in national seminar on Vamana at Kolhapur on topic mode of action of Vamana, and national seminar on clinical aspects of in Prasuti Tantra and Stri Roga at Kolhapur on topic Garbha. Sir has done many guest lectures at various institutes across the nation to the UG students and PG scholars on different topics of anatomy. Some of them are general consideration of nervous system for UG students, anatomical approach to Nasya Dravya Karmukata for PG scholars, and how to remember anatomy in various institutes like SDM Hassan, Parul University, Sanjeevani Ayurvedic Medical College, Hubli. Sir was also presented research papers in national, international seminars and published many articles in reputed journals. At present, Sir is working as Associate Professor, Department of Rachana Shareera, SVM Ayurvedic Medical College, Hospital, Research Center, Ilkal, Karnataka. Over to Dr. Shankarling Maidargi, sir.
Thank you very much, sir. So, Organizing Madam, shall I start my presentation?
Yes, sir. Yes, sir.
Okay. Sir, is it visible, sir?
Yes, sir. Yes, sir.
Okay. Om Shri Guru Basavalinkaya Namah. A warm good morning to everyone. So, here I am very happy to present my topic. So first I would like to thank the president of this function, Principal Dr. L.M. Biradar sir, and the organizing secretary, the Dr. Ushakala Patel madam. She has taken a lot of stress to conduct this webinar, and also the coordinator Dr. Shrikant, and the moderator Madam Dr. Dangi madam. So I'm very much thankful to all the organizer for recognizing me as a resource person. So today I'm going to present my topic over the upper respiratory tract and its clinical aspect. So I'm going to present my view over this topic. So the topic they have very nicely chosen in this pandemic, because its anatomy is very basic concept. They have to be read. The students has to be understand. Shall I continue, sir?
Hello, sir.
Yeah, sir.
Hello, sir. Just maximize your screen.
Yeah. I'm going to maximize, sir.
Thank you, sir.
Okay. So in this pandemic era, so we have to, the student must be having the thorough knowledge in the respiratory tract. Okay. So because of that, the organizer, they have selected this topic and they have divided it into the upper respiratory tract and the lower respiratory tract. The Ayurvedic view also they have taken, and how this COVID is going to affect our respiratory tract and what are these things. So today we have to think about what are the parts which are coming in the upper respiratory tract, then the lower respiratory tract, then what is the normal structure, then only you can understand what is the pathological condition which will occurs in the respiratory tract. Okay, so I'm going to start with my topic. So as I told, it's the upper respiratory tract. Okay, so today, I'm going to deal with these headings. That is, what are some facts are there? So related to the respiratory system, what is the respiratory system, and how we are going to divide this respiratory system, and what are the structures which are coming in the upper respiratory tract. So under that one, so we are going to deal in detail regarding the nose, pharynx and the larynx. So first we will move with the what are the factors of the respiratory system. Some facts we have to know things, some interesting facts are there, so that we usually do not study during our syllabus. So some interesting facts are there, so that we will see the things, what are the things are there. See, our body is more likely to inhale because not to the requirement of oxygen in our body, rather than because of the high carbon dioxide in the blood level, which will initiate to breathe that one. See, the more level of the carbon dioxide in our blood, so that is going to trigger our brain, then we will be breathing. So it doesn't that it is low level of the oxygen, even it will be there, but because of more level of the carbon dioxide is there, so that will make us to breathe. Okay, and we know that one usually. So that one, what is the normal breathing rate is there, that is 12 to 15 times per minute in the adult, and while in the newborn it's about 30 to 60 per minute. So when our brain senses that there is a shortage of oxygen, okay, in the blood, if the oxygen level is very short, it is going to trigger us to take a deep breath. Okay, what is that, the deep breath? That is the yawning. Okay, I think after seeing this picture, I think you are getting yawning also. This is one, that is the reflex activity. So I think that one, if in the class somebody yawns, you all the students start to yawn. So that is what the brain, it will reflex, because of the reflex, it is going to start with the taking the deep breath. Okay, then the average person can hold his breath up to 30 to 60 minutes maximum. We can hold maximum 30 to 60 minutes. Okay, but some facts are there, some persons are there, they can hold their breath up to 20 minutes. So next fact is that if you take our lung outside, and if we make it separated each and every part, if we unfold it and if we expand it, then it is going to stretch it to if we stretch it to fullest size, then it will be the size of the tennis court. Okay, you think that one, how much complex structure is situated inside the lung. Okay, see, if it is a part by part, if you have separated it and if you have spreaded it over the ground, then it will be the equal to the size of the tennis court. Then these are the organs, the lungs are the organs, they only can float in the water. So if you take the lungs out and if you put it to the water, they can float, but so no other organ in the body, they cannot be flown. Why? Because the internal structure of the lungs are arranged like that one. Those are related to the air. Okay, so the alveoli and other things are there, so those are always filled with the air. So because of that, the lung can float into the water. And inside the lungs, we will be having air sacs. There are the small air sacs are there. So you are looking here, the air sacs are there. Wait. So there are air sacs are there, so within the lungs, so those are helpful for the gaseous exchange. Okay, so it is estimated that around 300 to 500 million alveoli are there. So what these air sacs, so those are called as the alveoli. These alveoli, how much number? 300 to 500 million. See how much they are arranged very in a within the what small area of the lung. Okay, and the fact is that with the breathing, so we are going to breathe, we are going to lose the 12 ounce of the water. Okay, so 12 ounce of the water also we are going to lose every day with the respiration. Then the lung capacity of our lung is approximately 4 to 6 liters. So one lung, it can be hold the gas up to 4 to 6 liter, but per breathing we can only breathe 0.5 liter, means half of the liter we are going to breathe. So during inhale and exhale, so we can breathe only up to the half liter. So then if even we exhale, okay, so when we wait, so
Excuse me, sir.
Yes, yes, sir.
Sir, slideshow. Can you do slideshow?
Yeah.
Slideshow, sir. Slideshow. Can you put on the slideshow? Yes, sir.
Yes. Okay, sir. Okay. So when we what exhale,
Sir, still, hello.
yes, sir.
Sir, still we did not get full screen, sir. Slideshow.
Okay, it's on slideshow only, sir.
One more time, you click, sir, on that slideshow button. Icon, yes, sir.
Yeah, is it no? Okay, sir.
No, sir. No, bottom icon. No, sir. Still we are getting like without slideshow.
Wait, sir.
Sir.
Now it is minimized, I think.
Sir, yes, sir. Click, sir. Okay, sir. Please go on, sir.
Okay, no?
Yes, sir.
Yeah.
Yes, sir. Continue, sir.
Yeah. So during the inhalation, even with the what, if you really hardly exhale, so in the lungs, it is 1 to 1.2 liter of the air is going to remain in the lungs. Means we cannot put almost all the gas out of the lung. So next fact is that we don't have to think about our breathing. So whether we think about the breathing, no, it's what involuntarily it is going. The function it is going. So whenever there is a lack of the oxygen is there in the blood level, so then what it is going to trigger the what brain, in the brain, especially the brain stem. So brain stem is going to keep the watch over the our respiration. So it is called as the what controlling center. So the main vital part of this respiration is there. So that is, it is located over the what brain stem. So the brain stem is going to keep the control over the respiration. Then we know all the student, you know that one, that is the epiglottis. What is the function of the epiglottis? Since you were in the previous classes and the previous standards, you know that one. The epiglottis is going to cover the airway. Okay, so that airway is to be closed. So during the swallowing, the food particle has to be entered into the esophagus, and here you are looking that one, this is the epiglottis. This epiglottis is going to close the inlet of the airway, and because of this it can prevent the food particle that will be entered into the what respiratory tract, so that it is doesn't causing the obstruction to the respiration. Then, so these are the things that we have studied. What about the some interesting facts regarding our respiratory system? Okay, let me see some regarding the brief introduction regarding the respiratory system. First, what is the respiratory system? See, the respiratory system is consisting of the network of the organs and the tissue that will help you to breathe. Okay, so not only so things are there, the organs and the tissue, they togetherly working, so that will help us to breathe. Okay, so what are the things they are included within the respiratory system? So the airways means, so we are inhaling the air from the external environment, so that is going to pass to the lungs. So that is airway, the passage, the tube-like structures are there. So those are all the carrying the oxygen to the lungs. Okay, so when it reaches to the lungs, there the gaseous exchange occur, and within that one, so inhaled gas is going to exchange. Okay, so the oxygen is to be replaced into the blood, and rather, so that then the blood, from the blood, the carbon dioxide is coming back to these what bronchioles and the bronchial ducts, then the bronchus, then it goes to the trachea, and then it will be, we are going to exhale the air. Okay, so other than these, the organs and the tissues, so some of the muscles also supporting to the respiration. Okay, so what are the organs? Those muscles are there. Diaphragm is there. Intercostal muscles are there. Those are assisting for the respiration because of the contraction and the relaxation in those muscles. So that will allows the what the lungs to contract and the relaxation. So that is going to assist for our respiration. So these all the what the muscles and the organs and the tissue, they are going to work togetherly. Because of this, we are able to clean our body waste. So through the gases we are going to put outside. So nearly about 70% of the body waste. So those we can be expelled out of the body. Those will be eliminated of the body through the respiratory system. Okay, so that what I have told, that is 70% of the wastes are there of in our body. They will be eliminated through the respiration in the form of carbon dioxide. Okay, so other gases also be expelled. So this is what regarding the introduction of the respiratory system. Then next is the division, how we are going to divide our respiratory system. So for the what even for the study purpose and the how the structures they are arranged and how the structures are working, depending upon that we are going to do the divisions of the respiratory system. So first of all, we will do the what divisions of the respiratory system depending upon the basis of structures. Means what are the structures involved in the respiratory system. Depending upon that basis we are going to divide our respiratory system. So we are having the two divisions depending upon the structural division. So that is, one is the upper respiratory tract, one is the upper respiratory tract, what we are going to deal today. Then another one is the lower respiratory tract. One is the upper respiratory tract and second one is the lower respiratory tract. Okay, then what is the upper respiratory tract? Upper respiratory tract, so within that one, what are the structures involved? So we are going to divide the system structurally, no? Then if that, then what are the structures? So first of all, so what are the structures are there? First, there is a nose is there, then nasal cavity is there, then through the mouth also we are breathing, then next the gas is going to enter through the throat, or you can call it as the what medical terminology like pharynx. So the air is going to enter into the pharynx, then the gas is going to enter into the larynx. Okay, so these are all the structures we will consider it into the upper respiratory tract. Okay, upper respiratory tract, so which is collecting the air from the what the passage is collecting the air from the external environment. So there it includes the nose, then the nasal cavity, then the pharynx and the larynx. Okay, so these are all the parts of the upper respiratory tract. Then the thing is there, so next division according to structurally, that is the lower respiratory tract. Lower respiratory tract. So within the lower respiratory tract, so what are the structures are there? The trachea is there. So this is the trachea. The trachea is going to divide it into two principal bronchus, that is the right principal bronchus and another one is the left principal bronchus, and the air will be delivered into the lungs. So the organs are what? Trachea, then the bronchi, then the both the lungs. So these are all the structures which are coming in the lower respiratory tract. Okay, then what is the thing that one? So we have divided what the respiratory system into upper division, that is the upper respiratory tract, and another one is the lower respiratory tract. So we can say that in other meaning that one, the organs which are situated within the thoracic cavity, they can be considered as a lower respiratory tract. Okay, you understood? So within the thoracic cavity, there is what the lungs, bronchi, and some of the part of the trachea is there. So these are all the comes under the lower respiratory tract, and the organs which are situated out of the thoracic cavity like nose, nasal cavity, then pharynx and larynx, so that will be considered as the upper respiratory tract organs. Okay, so this is what the structural classification of the respiratory system. Next is the functional classification. So depending upon the what the function they are doing, this system, what the function it is doing, depending upon that basis, so we are going to be divide this into, one is the conducting zone and another one is the respiratory zone. Conducting zone and respiratory zone. See, conducting, what it is conducting? It is conducting the air from external environment to the lungs. So that is the conducting zone. So what is that? The major function is conducting zone are to provide the route for the incoming and outgoing air. So it is going to give the route only. It is going to what? It is going the pathway to reach the main organs of the respiration. That is the alveoli which are situated in the lungs. Okay, so it consists of what? That is the same, the nose, pharynx, larynx, trachea, bronchi, and up to the bronchioles. Okay, so these are all the organs which are coming in the conducting zone. So because they conduct the air to the lungs. Then next is the respiratory zone. You are looking at the respiratory zone. So what it is that where exactly the main function of the respiration occurs, that is the gaseous exchange. Okay, so that consists of the respiratory bronchioles, then alveolar ducts are there. Then so you are looking at, so this is the bronchioles, then these are the alveolar ducts are there, then the alveolar sacs are there, and inside there are alveoli are there. So where exactly the gaseous exchanges are there, and even some text they quote that the blood vessels are there, which are help to the carry the oxygen after the gaseous exchange. So the oxygen is going to be entered into the blood. Okay, from that blood it is going to enter to the heart. Okay, so those blood vessels also be considered under the respiratory zone. Okay, you got it now? So the functionally we can divide our respiratory system into the two parts, that is conducting zone and respiratory zone. Conducting zone is doing its function to carry the what? The oxygen.
Excuse me, sir.
Yes, sir.
Sir, slides not moving. Just change the slide, sir.
So
Lung capacity slide only visible. Please change the slide, sir.
is it, sir? Okay.
Next.
Okay.
Sir. Yes, sir. Now it is visible. Slides are moving. Okay, sir.
Okay, sir. I will do something different. So now it is visible, sir?
Yes, sir. Yes, sir.
Okay.
Yes, sir. Sir. Now it is slides are also visible, sir.
Okay, sir. Okay. So we have seen, I think it is some disturbance in there. So we have lung capacity means. So after this we have seen, I think. So this is what I have told. This is the brain is control for the respiration. Then regarding the epiglottis, I have explained. Then the respiratory introduction. So what is the organs which are involved and what is the structures are there in the respiration. Then the divisions I have told. This is the what we are going to divide on the structural basis, that is the upper respiratory tract and remaining the lower respiratory tract. Okay, then next one is the lower respiratory tract. It is there. Then functionally we are going to divide it into the conducting zone and another one is the respiratory zone. Okay, next is the structures of upper respiratory tract. So now it is visible, no sir? Shrikant sir?
Yes, sir. Yes, sir.
Okay, sir. So as I am going to deal with the topic that is the upper respiratory tract. So what once again I am recalling the structures. What are those are here? So first one is the nose. Okay, the nose is there. Okay, the first structure nose. Then when we go behind this one, so there is a cavity. So this is called as a nasal cavity. Okay, then through the mouth we also taking the air inside. So that is going to reach to the oropharynx. Then we are seeing the structures here. There is a what? Pharynx. The pharynx. Then it is the larynx. So these are all the structures which comes under the upper respiratory tract. So now we will go one by one structure. So especially I am going to deal here with the nose, nasal cavity, pharynx, and the larynx. Okay. So first, the thing is the nose is there. So the nose is the first part we will consider here in the upper respiratory tract. So we are going to breathe through the nose. So there will be some advantages if we breathe through the nose. So what we will get the benefit if we inspire our air through the nose. So first the thing is there, the air is going to be warmed. Air is going to be warm. When we inhale the gases inside, it is get warm by what? highly vascularized mucus. So inside the nasal cavity, the mucus is there, the lining of the mucus is there, which is having the rich blood supply, and even the venous drainage is there. Because of that, the air entering into the nasal cavity, it gets warmed. Okay, so why should we should warm the air? Because we have to match the temperature of the air with our body temperature. So it will become closer to the body temperature. So because of that, the air will get warmed inside the nasal cavity. Then some of the tiny hairs are there at the near the at the tip of the nose inside here. So there is a vibrissae, that is the tiny hairs are there, and the mucus of the nose is there, that is going to filter the air. That is going to filter the air. Because of this filtering, so we can prevent that one, the larger particles of the dust and some of the pollens, okay, which are going to cause the allergic condition. So that will be trapped by the mucous membrane, and by the hairs are there, those are going to filter the air by the larger dust particle. Okay, so that will helps to what, these are going to reach to the delicate lungs. Okay, so the air is going to reach to the delicate lungs. So there the air should be minimally, it is to be filtered. Okay, then next one, air is to be moistened. Okay, if you are breathing through the nose, then if the air going inside, so it will become moistened. So by the secretion of numerous serous glands are there, the mucus is there. So within the mucous membrane, so some of the serous glands are there, those are going to secrete the secretion, and that will makes the air moisten. Okay, so that will helps to, why we have to make it moisten? Because for the absorption, okay, alveoli are going to absorb. So because of that, so we are what, the air is to be moistened. So because of this, the what, this nose is called as the air conditioner, because it is making the condition which will be helpful to the body. Okay, so because of that, it is called as the air conditioner. So then it is the air what is inspired, it is going to reach the delicate lungs. So because of that, first it is to be warmed, and then it is to be filtered, then it is to be moistened for the easy absorption. Okay, so you got, I think. Then okay, so our nose is performing the two main functions. So the small function, just a little bit the functions I have told that one. The two main functions are there. Two main functions. So one is the respiration. Already we are studying under the respiratory system only. So that is, it is the function is what, respiration, and another one is the perception of the smell. We know that one. We are going to perceive the smell through the nose. Okay, so because the two functions are there, one is the perception of the smell, and another one is the respiration. So the receptors of the smell, what is a receptor? So that is the modified neurons are there. You can see that one here, the bipolar neurons which are arising. So here from the olfactory bulb, so bipolar neurons are there, those are going to end into the olfactory bulb, then it goes to the olfactory tract, then it reaches to the brain for the olfaction. Okay, so here you can see that when these are the nerve endings are there, so those are the bipolar type of the neurons, and these are called as a receptors. So where whatever the different type of the smells are there, those will be perceived here, and that will be reaches to the brain for the perception of the smell. So the mucus, there is a olfactory mucus is there. So in the upper 1/3 part of, so this is a total nasal cavity you are looking here. In the upper 1/3 part of the nasal cavity, so there is a what, olfactory mucosa is there, and remaining area that is called as the respiratory mucosa. In the mucosa, we are going to divide the upper 1/3 part as a what, olfactory mucosa, and remaining all the mucosa, that is the respiratory mucosa. Okay, then now we are going to divide our nose for the descriptive purpose to make it easy understanding. So we are going to divide it into the external nose and the nasal cavity. External nose and the nasal cavity. So what is the thing? So we will go in the detail of these two things. That is, one is the external nose. So simply I will tell you what is the external. So what we will look on the face. Okay, so that is externally what we can see, that is what, external nose simply. Okay, so for that nose we will be having the parts like there is a root is there, and the sloping areas are there. There are sloping areas are there. Those are called as the dorsum of the nose. Then there is a tip of the nose is there. So you can see the prominent tip. So that is the tip of the nose is there. Then the where through which the openings the air is entering. So these are called as the anterior nares, are also called as the nostrils. Okay. Then the nasal septum. Okay, the septum is there, which is going to divide the nasal cavity and this nose into the two equal halves. So that is the nasal septum. So we are going to deal in the detail in the next slide. Next, last is the columella. Columella is what this fibrofatty, which is tissue which is covered by the skin at the lower part. So this is called as the columella. So simply what we have seen, the root of the nose, then the dorsum, then the tip, then the anterior nares are the nostrils, then the nasal septum and the columella. So this is all the structures which we can see on the nose. That is the external nose. Next is structures, means the external nose is there by exactly by what structure it is made up of. Okay, so the external nose, it is made up of by the structures, that is the what's made by the skeletal framework. So it needs some support, no? So that framework, it is partly bony and partly cartilaginous. So you can see here. So this is what I am showing inside. If you remove the skin and the other fatty tissue and all the things, you can see that some part is bony and remaining all the cartilages are there. Okay, so the bony part, which is only the what upper 1/3 part is there, and the lower part is there. So this is the 2/3 part, it is covered by the cartilaginous part. Okay, so upper 1/3 by the bones and the lower part is by the cartilaginous part. So what are the bones are included? So if it is a bony frame, then what are the bones are there? So that is, one is the nasal bone, what by the side. So this is the nasal bones. Then next one is the frontal process of the maxilla. So this, you know that one, this is the maxillary bone. Among this, the part of the maxillary bone, that is the frontal process of the maxilla. And the nasal bone. So these two bones are involved in the what structures of the this external bone. Then next part is cartilages. Okay, what are the cartilages are involved here? So that is the two lateral cartilages. You are looking, the large cartilages are there. So these are the two lateral cartilages and a single median septal cartilage. Okay, you are looking here. So this is depth here. So only the part we are looking outside here. This is called as a septal cartilage. So one is the lateral cartilage, right and left lateral cartilages are there, and one is the septal cartilage and the alar cartilage. So the two major alar cartilage and again the minor alar cartilages are coming here. So major cartilage and minor cartilage. So these are the cartilages. So we have seen that one. So there is the two lateral cartilages, then the septal cartilages, then alar cartilage, major alar cartilage and minor alar cartilages are there. So these are all going to make the what the structures for the external nose. So let me see some clinical condition, clinical correlation with these structures. That is, our nose is what it is most exposure part in the face. See, if anybody goes with the facial injuries, then most of the time the nasal fractures are common. Okay, why? Because it is most projecting part in the face. Okay, it is coming somewhat, it is outward, no, so it is located. So because of that, in the most of the time the nose will get fractured. The bones of the nasal bones, this will be get fractured. So that is the one of the common facial fractures. In the facial fractures, the nasal bone fracture is common. Okay, then medial and lateral crura of major alar cartilage. So I will show you here. So this is the lateral crura and this is the medial crura of the alar cartilage. Just we have seen in the previous slide, that is what is the alar. So this is major alar cartilage you are looking here. This is going to cover on the lateral aspect and in the medial aspect. So because of this, angulation is what kept here. So there is a what angulation between the these two cruras. There is a medial crura and the lateral crura. So this angle, this is going to keep the what nasal way, airway, that is the airway patent. Okay, because of that only the nostril kept open. Okay, then this angle, the same angle, it is going to play the what major role in the plastic surgery, in the cosmetic values. This is what these the cartilages are going to be corrected, and then it what it shows the beautiful face. So I think some of the actors, they undergoes for the plastic surgery, that to make their nose shape, okay, to give the beautiful shape to their nose. So to make the tip of the nose is to be changed in the surgery. So this place, these cartilages are going to the structures are going to help for the beautiful this cosmetic surgeries. Okay, I think another silly thing I want to discuss you here, the upper bony part is there. Okay, upper bony part is there, and lower is the cartilaginous part is there. I think most of you put the finger into the nostril, is it no? So why? Because it is a cartilaginous part. If it is completely bony part, you cannot put your fingers. Okay, so it is not anatomy. So simply I am taking this point as a discussion. Okay, so this is cartilaginous part. This is soft structure is there. Okay, so because the modifications, okay, so you will know that one. So this is cartilaginous. So because of this, the patency, so the nostrils are kept open. So this is the nature they have did the what the framework for this, the external nose. Okay, I think you understood regarding up to the nose. Next, we will move to the nasal cavity. Okay. See, what I am discussing today, it's a very large topic. Oh, this is even the nasal nose, nasal cavity, and all the things are there. So this will take even single topic. It takes 3 to 4 classes. Nasal cavity, larynx, pharynx are there. I am going to cover almost all the points here. So let me see. Okay, see, nasal cavity. The nasal cavity is there where it is starts, where it is going to end. Okay, so it is going to end starts from the external nose. So just we have seen in the external nose, that is the from the external nose to the posterior nasal aperture. This is what you are looking. This is the what? Nasopharynx. This part you are looking here, somewhat dark color, pink color is there. So this is the nasopharynx. So where this nasal cavity is going to join with the nasopharynx. So this opening, what you are looking here. So this is we have taken the section. When we look from the posterior view, exactly there is a what the circular opening is there, which may allow the nasal cavity to enter into the nasopharynx. So this is called as the posterior nasal aperture. Posterior nasal aperture. So the extent of our nasal cavity is from the external nose to the posterior nasal aperture. Okay, then it is subdivided. The nasal cavity is divided into right and left half by the nasal septum. So we are having the 2 halves in the nasal cavity, right half and the left half. That partition is done by the nasal septum. So we have seen one of the part, just we have seen that is a septal cartilage is there. So again, some bones are coming, we will discuss later. Then so in the each half, so now we are looking one half. Here in this diagram, we are looking one half. So each half, it is having the roof is there. Then it is having a floor is there. Then what we are looking here, this is called as a lateral wall. Where we are looking irregular wall is there. So this is called as a lateral wall, and its opposite wall, which is making the septum. The nasal septum is there. No, so the nasal septum, which makes the medial wall. Then the measurement of this nasal cavity, the height is 5 centimeter. The height of this nasal cavity is 5 centimeter. Then the length is 5 to 7 centimeter length. Okay. Then width is 1.5 centimeter near the floor. So this is the floor, no? Near the floor, the width is there 1.5 centimeter, and near the roof, it will be 1 to 2 mm. Means it is somewhat broader near the roof. Okay, and narrower towards the floor. Next, the same thing we have to go in detail. That is the what is the roof? Okay, the roof is there. The roof is measuring about what the 7 centimeter long and 2 mm wide. That's just I am show you what is the roof. This much is total. So the roof is there. This is the roof. The roof is there. The roof is measures about 7 centimeter long and 2 mm wide. Just I have told that is 1 to 2 mm wide is there. Then it slopes in the downward direction, and it slopes downward. So it is what you are looking. This is the rope. It is going to slopes even in the front and even in the back direction. Okay, so in the middle there is a horizontal part is there. In the middle, horizontal part is there, and the anterior end and posterior end are these are going to slope. So this horizontal part is there. This is formed by the cribriform plate of the ethmoid bone. This is formed by the cribriform plate of the ethmoid bone. See, these are the cribriform plate where you are looking. So many pores are there. So through this one, the olfactory bipolar neurons, those are going to enter to the olfactory tract, olfactory bulb, then it goes to the olfactory tract. So here, this is for the passage for the bipolar neurons. Okay, so this is the bone. This is called as a what? The cribriform plate of the ethmoid bone. Ethmoid bone. Then I have told, no, there are two slopes are there. One is the anterior slope and another one is the posterior slope. So the anterior slope, it is made by the nasal bone, nasal part of the frontal bone, then the nasal bone, then the nasal cartilage. The three structures, one is the what? Nasal bone of the frontal bone, then the nasal bone, then the cartilage. These are going to make the front slope. And next one is the what? The posterior slope. The posterior slope, it is formed by the body of the sphenoid bone. It is formed by the body of the sphenoid bone. So let me see the floor. The floor is there. So just I will show you. So just we have discussed, this is the roof is there. What is the roof? Then the floor is there. The floor is which measures about 5 centimeter in the length, and the width is 1.5 centimeter wide. Okay. So here the floor is there. The floor is formed by the what? The palatine process of the maxilla bone and the horizontal plate of the palatine bone. So you are looking, this is the what? The palatine process of the maxillary bone, and this is the horizontal plate of the palatine bone. This is simply, we can see that one. What are the bones which makes the hard palate? The bones of the hard palate, they will make the floor for the nasal cavity. Okay. Then it is concave from side to side in the, it is when we look at from the what? In the nasal cavity inside, it is concave from side to side. Okay. Then it is slightly higher in the anterior aspect. You can see that one. It is, the floor is there slightly higher in the anterior aspect than compared with the posterior aspect. Okay. So this is what we have seen. That is the what? The floor. Next is the nasal septum. Nasal septum. That is what we can see that one. That is the medial wall. Medial wall. The medial wall of the each nasal cavity is formed by the nasal septum. So we have to see the what are the features are there. That is, this is what you are looking. This is the nasal septum. So here on this side, if you take, this is the left nostril. On the other side, on the next to this one, another nasal cavity is there, so that you can, what is the right nostril. So you are looking here, this is the right nostril and this is the left nostril here. So here, this is what the lower part of this septum, this is called as a columella. So if you go in deep, this is the continuation. This is the continuation. What we are looking here. So this is called as a nasal septum. Okay, so this is formed by the, again, osteocartilaginous part. Osteo means the bones, osteo, and partly it is cartilaginous, means even the bones are also involved and the cartilage is also there. So which is making the nasal septum. Then what are the things are there? So on the each side it is covered by the mucous membrane, means it here on the both the medial walls, on the both the medial walls which are covered by the mucous membrane, and these are going to form the medial wall for the both the nasal cavities. Okay, so let me think that one, what are the bones involved here in the formation of nasal septum? That is, the Omer bone is there. So this is the Omer bone. Then the perpendicular plate of the ethmoid bone. So these are making the bony part of this nasal septum, and the cartilage involved here. So that is called as the septal cartilage. This is the septal cartilage. So this is going to form the what? The total structure of the nasal septum. And lastly, the lower end of this septum, this septum. So this is called as a cuticular part. This is called as a, so here we can see inside, that is the lower part. So that is called as a cuticular part. So which is formed by the fibrofatty tissue. Fibrous structure are there. Some of the fat is collection is there. Over that one, there is a covering of the skin is there. Okay. So the lower part, it is the what? Made up by the fibrous tissue and fatty tissue, and over that there is a skin is covered. So that is called as a cuticular part. Okay, then lastly, you know that one, that is the columella, so which we can see externally. So this is the columella, the lower margin, the lower, you can say this one, this is the lower margin of this nasal septum. So this is called as a columella. Okay, next one is this nasal septum is strict. So in the what, rarely strictly median. The two things are there, rarely strictly median. So means almost in the maximum of the condition. So it is going to deviate on the some side. Okay, either towards the right side or to the left side, it is going to be deviate. But it is in very less condition. It is strictly situated in the median condition. Then its central part is usually deflected. The same thing I have told, that the center part is there. It is going to defect. It is going to be deviated either towards the right side or towards the left side. Okay. Then this what deviation, it is going to produce the overgrowth. So only if it is deviated, there is no problem. Okay. If that deviation, it is going to cause the overgrowth. If the overgrowth occurs, then it is going to cause the obstruction to the what, air passage. Okay, then the clinical correlation that I am going to do the same thing here. That one, the condition is called as a deviated nasal septum. In the final year, we are going to study that one in the what is the DNS, that is the deviated nasal septum. So what is that? So this you are looking here, this is the normal septum. So the normal septum, it is looks like, but here you are looking, there is a deviation is there. This is going to deviated in the left nostril. So because of this, it is going to cause the nasal obstruction. It is going to cause a nasal obstruction for the air passage. So it can be corrected by the surgically. It can be, we can treat it by surgically. That surgery is called as the submucous resection or the septoplasty. It is called as the septoplasty. And we have to think about that one. So this septum is there, nasal septum is there. It is going to provide the what? The support for the nose. It going to, not only it is going to divide the right nasal cavity into the left nasal cavity, also it gives the what, support to our nasal cavity. If during the surgery, if you put injury to the maximum part of this bone, then it causes the condition called as a supratip depression. Okay, we are looking at supratip depression. So this is going to cause the condition called as a supratip depression. So the maximum part of the septum is not to be removed. Then we'll move to the blood supply for this nasal septum. Okay, so anterior superior part. So this is the nasal cavity we are looking at. So this is on the anterior and the superior part. Anterior and the superior part, it is by the two ethmoidal artery. That is the anterior ethmoidal artery, and another one is the posterior ethmoidal artery. So those are the branch which are arising from the ophthalmic artery. Okay, again the ophthalmic artery, those are the branch of the internal carotid artery. Then anterior inferior part is there. So that is going to be supplied by the labial branch of the facial artery. Then posterior part, in the posterior part and the superior part, this is supplied by the maxillary artery. So which is this is the splenopalatine artery. So you are looking at, this is the splenopalatine artery, which is the branch of the maxillary artery. Maxillary branch, that is the external carotid. So that is the main artery of this medial septum, that is the nasal septum. Then the anterior inferior part, in the anterior aspect and in the inferior aspect, so we are having the anastomosis of the all these artery get anastomosis, and they are going to supply on the what, anterior and inferior part of this medial side of the nose. So that is called as the little's area, this confluence. So even the veins also there. So those are collectively, they makes the what, the anastomosis of the all the arteries. So this is called as the little's area. Okay, so this totally right, and this is the common site of the bleeding. It is the common site of the bleeding. So that is called as the epistaxis. What is the epistaxis? So that is the bleeding from the nose. So I think in the when you are in the child, or even in the severe heart conditions, in the summer condition, suddenly you start the bleeding from your nose. So that is called as the condition epistaxis. Okay, that is because of rupture of these vessels, the network of the vessels. So that is called as the little's area. Next, the venous drainage is there. So the little area is going to drain into the facial vein, and the posteriorly this is going to drain into the splenopalatine vein. It is going to drain into the splenopalatine vein. Through that one, it is going to enter into the pterygoid plexus of the pterygoid dural venous plexus. So that is, it is at the base of the brain. Okay, then we have to go for the nerve supply. So many nerve supplies are there. Only I have considering one is for the general sensation. So general sensation, that is through the trigeminal nerve. Okay, trigeminal nerve is there for the general sensation. General sensation means that is the sensation like touch, pain, then the temperature, all such type of the general sensation will be through the trigeminal nerve. Then spatial sensation. What is a spatial sensation? We are going to olfact. We are in the what? We are going to perceive the smell from here. That is called as the what? Olfaction. So that is possible through the olfactory nerve. That is the first cranial nerve. Okay, so other than that, that is the other area. There is the ethmoidal nerves are there. Those are going to anterior ethmoidal nerve is there. Then the posterior ethmoidal. So those are going to cover the nerve supply to this nasal medial wall of the nasal cavity. So next other point we have to see that one, the lateral wall. Okay, lateral wall. So what you are looking here? So this is, it seems the irregular wall. It is a irregular wall is there. So what is that? It presents, it shows are the three shelf-like bony projection. Those are called as the concha. So in the lateral, so just we have finished. What is that? The roof we have seen. What is the roof is there, and what is the floor we have seen. Then we have finished up with the nasal septum, that is the medial wall. Okay, then we are going through this one. What is the lateral wall? So lateral wall, it shows the three shelf-like projections. So these are called as a concha. 1, 2, 3. There are three conchas are there. The bony projection, there is a shelf-like projection. So those are called as what? Concha. Okay, then the concha, what is the concha? So these are going to increase the surface area. These are going to what? Increase the surface area for the effective air conditioning of the air. So just I have told, so the nose has to be make the conditions of the air to go inside the respiratory passage. So that one, so if the surface area is more larger, then more blood vessels will be there. Then it is going to give the more mucous membrane. Then it is going to do its function perfectly. Okay. Then, so this lateral area, the lateral wall is there. So this is going to divided first as a vestibule. You are looking here. This is the vestibule. That is a small depressed area in the anterior part. Small depressed area in the anterior part. So this is called as a vestibule, and this is covered by the what? Skin. This is covered by a modified skin. Okay, so to this skin, there consists of a short, stiff, curved hairs are there. We know that when, so from the nostrils, there will be hairs are projecting here. So I have told already to trap the dust particle, large dust particles. So the hairs are there. So those are called as a vibrissae. Okay, then the middle part. I am showing you this one, the middle part. So this is called as the atrium of the middle meatus. This is called as the atrium of the middle meatus. So this is going to form the middle part. Then the posterior most part is called as the, it is covered by the conchas, and the narrow passage is there. So that is called as a meatus. That we are going to deal in detail. So first the conchas. So conchas are what? These are the bony projection. So it is what you are looking, this is the bony projection. Over that one there is a mucous lining is there. Okay, so exactly these are the shelf-like projection because of the bone. Okay, the projecting bones are there which are projecting directed downwards and medially. These are directing downwards and medial direction. Then the three conchas are usually found, means sometimes we will find more or less conchas. Usually we will find the three conchas. Okay, so what are the conchas? The first one, inferior concha, so which is made up of by the independent bone. Okay, then the middle concha and the superior concha. Middle concha and the superior concha are there. So these are formed from the what? Medial surface of the ethmoidal labyrinth. So this is the bone. So the what? The medial surface of the ethmoidal labyrinth. From this bone, the middle concha and the superior concha, these two are formed. Okay, so this is regarding the conchas. Okay, then the meatus. What are the meatus? So these are the passages. So you are looking at, this is the one passage, and here there is a passage, and the small passage is here. So these are the meatus. Those are what? The projection. Below that projection there is a passage is there. Below that projection there is a passage is there. So those are called as the meatus. Okay, so each meatus, 1, 2, 3, these are going to freely communicate with the nasal cavity. Okay, those are going to communicate with the what? On the anterior aspect and on the medial aspect. Okay, so the inferior meatus, here we are looking here, the inferior meatus, it is the largest meatus. Okay, so within this meatus, so the nasolacrimal duct is going to open here. Nasolacrimal duct. Okay, when you are crying, your nose is running, is it no? So why? Because the nasolacrimal apparatus is there. Okay, so that apparatus, it is going to collect the tears from the eyes, and then through the nasolacrimal apparatus, lastly the duct comes. That duct is going to open here in the what? Inferior meatus. So there the nasal secretion start. Okay, then next one is the middle meatus. Okay, which is situated beneath the middle concha. Here we can see the opening of frontal air sinus, then ethmoidal air sinus, then the maxillary air sinus. So the frontal sinus is there, then the ethmoidal air sinus, the anterior ethmoidal sinus, then the maxillary sinus. So these all the sinus, those are going to open into the middle meatus, which is below the middle concha. Okay, then the superior meatus is there. The superior meatus is here. So which is situated below the superior concha. Okay, you know that one, below the superior concha only the meatus is there. So this is the shortest and shallowest of all the meatus. Okay, and here the sphenoidal air sinus, you are looking here, this is the sphenoid sinus. So this sphenoidal air sinus, it is going to open into the what? The superior meatus. Okay, so because of this, the whatever the infection which are entering into the nose, they can cause the infection to these sinus. So then you are going to suffer from the sinusitis. So you are looking, these all the sinus are going to open into the lateral wall of the nasal cavity. Okay, so these are the track to enter the infection through this, from lateral wall to these all the sinuses. Okay, so the same thing we are looking here. The lateral wall, there is a clinical correlation. First thing is the rhinitis. Okay, so what is the rhinitis? That is the inflammation of a mucous membrane. So the inside the nasal cavity, I have told already. So all the structure, it is lined by the mucous membrane. So either for the infection or for the allergic condition, if the inflammation occurs, so then this condition is called as a rhinitis. So that is characterized by what? Running nose, blockage of the nose, difficulty in the breathing, repeated sneezing is there. So this is all the symptoms of the rhinitis. Okay, and another main thing you have to think here, that one, if the hypertrophy occurs in the inferior concha, just we have seen, that is, you can see that one, how they will looks in the, when we view from this view. Okay, when we view from this view, these are the what? This is superior concha, middle concha, and this is the inferior concha. So you are looking that one, this is the normal size of the concha. If this concha is enlarged, so this condition, it shows the allergic rhinitis. So you can easily diagnose. So it is not in the all the condition, but you have to make the differential diagnosis. So if it is enlarged, so it is most of the condition, it is because of the allergic rhinitis. Okay, then how we have to do the nasal examination? Okay, we can do the nasal examination through what you are looking at. So this is through the nostril by the instrument that is called as an anterior rhinoscope. So what he is holding here to dilate or to expand the nasal opening like this one. So this is what called as an anterior rhinoscope. Okay, we can examine inside, what we can see inside here. Then through the pharynx, okay, what you are looking here, we can put up to what? Back of here. So we can look at here what is the things into the what pharynx. So this is called as a posterior rhinoscopy. Posterior rhinoscopy. Okay, so this is called how we can, this is how we can examine the nasal cavity. Okay, so this is all what I have finished up with the what nose. So there in the nose, first we have divided into the what external nose and the internal nose. So that is the nasal cavity. The nasal cavity, it is having the what roof, floor, medial wall and the lateral wall. So we have seen the septums, that is the nasal septum, and in the lateral wall there are 3 concas are there and 3 meatuses are there, and almost the air sinuses are going to open into the lateral wall, and the clinical correlation also we have finished. Okay, next topic is pharynx. Okay, so the pharynx is that I will show you here first the outline of this pharynx. Okay, so this is what you are looking at. This is the pharynx. Okay, so this is the what it is, wide muscular tube. It is the wide muscular tube which is situated behind the nose, then behind the mouth and behind the larynx. Okay, the passage or the tube which is situated behind the nose, behind the mouth and behind the larynx. So this passage, it is called as the pharynx. Okay, then it is clinically the part of the upper respiratory passage. Okay, so already we know that one, this comes under the upper respiratory part. Then the infections are more common. I think your doctor tell that you are suffering from upper respiratory tract infection, URTI. Okay, so there you are going to what, having the dry cough and all the things. Okay, so dry cough is there, sore throat is there, and hoarseness of the voice is there. So because of the upper respiratory, that is the pharynx is infected there. Okay, then so the function, what is that? The function is the upper part is there, it is only the passage for the air because it is situated behind the nose. Okay, so because of that, it is only the passage for the air, and the middle part is there, it is what, sorry, the lower part is there. So this is the only part for the food entrance, because below it is going to continue as a esophagus. Okay, upper part, it is the passage for only the air, and lower part is only passage for the food. But the middle part, it is the passage for both air and the food. Then the dimensions, the measurements are there. So what is the length? It is 12 centimeter in the length. It measures about 12 centimeter in the length. Then width. So width is going to vary from place to place. That is, so in the upper part, so what we are looking, this is the widest part. In the pharynx only, it is the widest part, which measures about 3.5 centimeter, and it is non-collapsible. Okay, it is not, it is permanent. So it is 3.5 centimeter. Then the middle part is narrow part. Middle part is the narrow part. Then most narrowest part is the what, lower end. This is the lowest part is there. It is the what, narrowest part of the GI tract, because here it is going to continue as a esophagus. That is the esophagopharyngeal junction. So that is called as the narrowest part of the GI tract, even exception to the appendix. So appendix and the this esophageal and the pharyngeal junction, so those are called as the narrowest part of the pharynx. That is the total, this is the GI tract. Let me see what are the boundaries which are making for this muscular tube. So what is that? So boundary, here we can see that one. So I will show you, this is the what, pharynx. Okay, so what are the structures are coming, that we will see. So first, superiorly, this is the superior boundary. It is related to the base of the skull. It is related to the base of the skull. So base of the, not total base of the skull. So that we have to study now here. So that is the part of the body of the sphenoid bone. Here, this is the sphenoid bone. What you think? This is the sphenoid air sinus, and this is the what? This is the what, body of the sphenoid bone. So part of the body of the sphenoid bone and basilar part of the occipital bone. So you are looking the total green color. This is the occipital bone, which the part of the bone which is situated in front of the foramina magnum. So this is called as the what, basilar part of the occipital bone. Okay, so these bones are making the superior boundary. Then we know that one inferiorly. So this is superior boundary, just we have seen. Then inferiorly, it is going to continue as a esophagus. Where exactly? At the lower border of the cricoid cartilage. Just we are going to study what is the cricoid cartilage. So, and if you go for the vertebral level, it is situated at the level of 6th cervical vertebra. At the level of 6th cervical vertebra, the this pharynx is there. So that is the that is the laryngopharynx is going to continue as the esophagus, inferior communication. Then this posteriorly, the posterior boundary, it is going to be related to the vertebral column. But in between this pharynx and the vertebral column, there is a fascia is coming. So this is called as the prevertebral fascia. The fascia is coming, so that fascia is the prevertebral, before the vertebra. So this is the modification of the fascia of the neck region. So that is the what over this one, this pharynx is going to glide, or it is going to move over this prevertebral fascia. Okay. Then next thing, anteriorly. So we have seen there is a roof is there. Then the inferiorly, the relation we have seen. Then posterior relation we have finished. Then anterior relation. Anterior relation is incomplete because it is having all the openings. That is the opening of the nasal cavity, opening of the oral cavity, and the inlet of the larynx. Okay, so these are all going to open into the anterior wall of this pharynx. Okay, then now we are looking the side relation. What are the side structures which are coming here? On the each side, the pharynx is attached to what? Medial pterygoid plate and the mandible. So medial pterygoid plate. So these are also the part of this sphenoid bone. So you are looking, this is the medial pterygoid plate and this is the lateral pterygoid plate. So this is on the side, it is related to the medial pterygoid plate. Then the mandible is coming here. So mandible, it is related. Then tongue is also coming in the side structure. Hyoid bone is there. Then thyroid and the cricoid cartilage. Okay. Then communication. So this is communicating anteriorly. We know that one, all the cavities, that is the what? Nasal cavity, oral cavity, and to the larynx it is communicating. Then other communications are there. What are that? It is going to communicate to the what? For the middle ear. It is going to communicate for the middle ear through the tube called as the what? Auditory tube. So you are looking here, there is a opening is here. This opening which is going to open into the middle ear. So we are going to divide the ear into what? External ear, middle ear, and internal ear. So it is this opening is going to enter the canal. It is going to join the middle ear cavity. So this is called as the auditory tube. Then the pharynx on the either side, it is related to, means on the side structures. What are the structures are coming? That is the styloid process and muscle attached to it. So you are looking the sharp spine-like process. So this is called as a styloid process. The muscle attached to it. The muscle attached to it is the stylopharyngeus muscle, then styloglossus muscle, then the stylohyoid muscle. The three muscles are attached here. And so you are looking at, so from this is the posterior view of our pharynx. And you are looking some muscles, the longitudinally the muscles are running. So these muscles are coming in the side relation. So those are muscle attached to this styloid process. Okay. Then some of the vessels and the nerves are coming. What are the vessels? So that is the common carotid artery and the branches. So common carotid artery and its terminal branches as a what? Internal carotid artery, and another one is the external carotid artery, and the nerves is coming here. So the nerve is what? The vagus nerve and the glossopharyngeal nerve, which are coming in the side relation. Now I will show you the posterior view, because anterior view is not complete. The posterior view is here. So you can see this is the structure of the pharynx. So let me see the parts of the pharynx. So the parts of the pharynx are that the cavity is going to be divided into the nasal part as a nasopharynx, oral part as a oropharynx, and the laryngeal part as a laryngopharynx. So which is situated behind this nose, this is called as the nasopharynx. Okay, which is situated behind the oral cavity, so this is called as a oropharynx, and which is situated behind the opening of this larynx, so this is called as a laryngopharynx. So we are going to divide this into nasopharynx, oropharynx, and the laryngopharynx. Okay, The first, we will go in detail of the nasopharynx. So already I have told the nasopharynx is situated behind the nose. It is going to situated behind the nose, and it is going to extend. Okay, so we have to make it some boundaries, no, from where to where it is extending. So from the base of the skull, from the base of the skull to the soft palate, you are looking the lower part of the soft palate. So this much area, it is considered as a nasopharynx. Okay, the communication, it is anteriorly, it is going to communicate with the nasal cavity, and below it is going to communicate with the oropharynx. And another communication is there that I have told, that is the auditory opening. That is the auditory canal is going to open into the middle ear cavity. So the part, this is going to be supplied by the pharyngeal branch of the pterygopalatine ganglion, the nerves supply of the nasopharynx. So let me see some more detail in the relations of this nasopharynx. Okay, so this is the nasopharynx here. So anteriorly, on the anterior aspect, it is related to the posterior nasal aperture. Okay, so what is that? This is the anterior nase. So this is going to open here at the nasal cavity is going to open into the nasopharynx through this opening. So this is called as what? Posterior nasal aperture. So anterior relation. Then posterior relation and the roof and the posterior relation, it is formed by the body of the sphenoid bone, then basilar part of the occipital bone. In the last slide I have told that one. So that is the basilar part of the occipital bone, then anterior arch of the atlas. Okay, what is atlas? That is the first cervical vertebra. So the arch of that atlas is there, making the posterior boundary. Then here in the roof, we will get the two structures are there. One is called as a nasopharyngeal tonsil. So you are looking, there is some lymphoid tissue you are looking here. So this is called as the one tonsil, the name is, which is located in the nasopharynx. Because of that, it is called as a nasopharyngeal tonsil, which is more prominent in the children. Okay, so this between this nasopharyngeal tonsil and the bony part here, there is a bursa is there. Okay, there's a fluid filled cavity is there. So that is the mucus diverticulum. This is the outpouching of the mucus. So that is called as a nasopharyngeal bursa. Okay, then the lateral wall. So the lateral wall, we are looking at what is this? This is the lateral wall only. So here we will see the one opening. So this is called as the opening for the auditory tube, opening of the auditory tube. Which opening? Medial opening of the auditory tube. Okay, so here near to this opening there is a one tonsil is there. So that is called as a tubal tonsil. So in the nasopharynx we will be getting the two tonsil. One is called as the nasopharyngeal tonsil and another one is called as a tubal tonsil. And the epithelium of this part, it is called as a ciliated columnar epithelium, and we know that the function is only to pass the air. Okay, so let me see some clinical conditions here. Adenoids. Okay, so what are these condition? Adenoids is, I have told that one already. There is a here in the roof, there is a one tonsil is there. So that is called as a nasopharyngeal tonsil. And I have told already it is prominent in the children. Okay, up to what age it is prominent? Up to the 6th year it is prominent. Up to 6th year of the age it is prominent. Then it is gradually undergoes atrophy. Atrophy means it goes into shrinking. Okay, it will reduce its size because other immunity system is developed and it is going to reduce in its size, and it is completely disappear by the age of 20 years. Okay, you got it now. So then if this nasal pharynx is inflamed, if the nasal pharynx is inflamed, when the inflammation occurs due to the infection, if it is inflamed, then that condition is called as a adenoid. Condition is called as a adenoid. The enlargement is such that it is going to close the airway. That is the posterior nasal aperture is going to close here. So because of that, the child starts their mouth breathing. They start with the mouth breathing. So this is what is the adenoid. Then next part is oropharynx. So oropharynx, just I have told it is situated behind the oral cavity. Okay. So then extension is, we have to say that one from the soft palate to the upper border of the epiglottis. So anteriorly it is going to communicate with the oral cavity, above with the nasal cavity, and below with the laryngopharynx. And it is supplied by the 9th and the 10th nerve. There is a glossopharyngeal and the vagus cranial nerves, and the relations are anteriorly it is related to the oral cavity. Okay, and posteriorly and the roof, it is formed by the body of the second and the third cervical vertebra. The posterior relation. Then the lateral wall. What is the oropharynx is related? It is containing the palatine tonsil. You are looking here. This is the one tonsil. What you are looking? This is the palatine tonsil. Okay, so which is situated in the palatine fossa, which is formed by the the two folds. That is the pharyngoglossal and the palatoglossal and the palatopharyngeal folds are there within that fossa. This tonsil is there. Usually what we will say that one, I am suffering from tonsillitis, so that tonsil is this one. So that is what you can see in your mouth. When you open the mouth, inside you can see the tonsil. This is called as the palatine tonsil. Okay, then the epithelium is stratified squamous non-keratinized type of the epithelium, and the function is to pass both air and the food. Okay, so the clinical correlation of this oropharynx is that one. So as it is the passage for both air and the food. Okay, it is the passage for both air and the food. Sometime the food particle, it is going to enter into the airway. Okay, so that condition is called as a choking. Okay, so what, because of that the person, okay, he feels the severe obstruction to the airway, so then he suddenly start coughing, and because of that the food particle comes out, and that going to cause the relief of the respiratory airways. Okay, similarly this what happens, the air is going to enter into the GI tract. Then it causes the gas collection in the stomach. Then it will be produce the belchings. Okay, so this is clinical correlation. Then last of the pharynx, so that is called as a laryngopharynx. Okay, the laryngopharynx is which is situated behind the larynx. So you are looking here, this is the larynx which is situated behind the larynx, and it is going to extend from the upper border of the epiglottis to the lower border of the cricoid cartilage. Okay, why? Because from the lower border of the cricoid cartilage, esophagus is going to start here. The last part, it is starts from the this is the cartilage, so this is called as a epiglottis. From the epiglottis to the cricoid cartilage. So communication, we'll say that one, anteriorly it is communicating with the larynx, below with the esophagus, and above with the nasopharynx. Okay, the same nerves are going to supply, that is the 9th and 10th cranial nerves, and relations are anteriorly, that is the inlet of the larynx. Okay, then posterior surface. So you are looking, this is the cricoid cartilage. What are the cartilage in the larynx we are going to study here, and the arytenoid cartilage. Above this one, the small cartilages will be there. That is the arytenoid cartilage. Okay, and posterior boundary is there. So this is formed by the 4th and the 5th cervical vertebra. Okay, so now we are looking, this is total pharynx when we open it from the posterior side. Okay, here you are looking here, this is a posterior nasal aperture. You are looking, these are the concas, this is the nasal cavity. Then here, this is the oral cavity, and just below you are looking, this is the larynx, entry to the larynx. Okay, so the lateral wall is there. So the lateral wall, so now we are looking, this is the laryngopharynx. This part we are discussing, no? This is epiglottis. So on the lateral wall, so there we will getting the structure called as a pyriform fossa. The structure, there is a deep structure is you are looking here. This is the pyriform fossa on the each side of the inlet of the larynx. So this is where we are entering inside to the larynx, and here there is a continuation of as a trachea. Okay, we are going to enter here. So on the either side of this inlet, so we will be getting, there is a place is there. So that is called as a pyriform fossa. So which is bounded, okay, the bounded by the aryepiglottic fold medially and thyroid cartilage laterally. See, this is here, this is the is cartilage, and here there is a alternate cartilage is there. The mucous membrane which is binding them, so this is called as a epiglottic fold is there. And when we go in the anterior aspect, here on the lateral side of the thyroid cartilage comes here. Okay, so this is going to make the pyriform fossa. On the lateral aspect, we will get the pyriform fossa. So epithelium is stratified squamous, non-keratinized type of the epithelium is there, and the function of this laryngopharynx is only passes for the food. Here it is below, it is continuous as a esophagus. Okay, now we will look at some clinical correlation of this pyriform fossa. Okay, just I have told there are the space on the either side of the inlet of the larynx. So first I will show you the normal structure, how it will looks in the endoscopic view. So you are looking, this is the epiglottic cartilage. Epiglottis is there, and these are the arytenoid small cartilage, and the fold is there. This is called as a epiglottic fold. Epiglottic fold is there. Okay, so when we go on the side here, this depression you are looking here, so this is called as the pyriform fossa. This is called as a pyriform fossa. Okay, and this is where you are entering into the larynx. Okay, so this is what happens here during the endoscopy. This sometimes the endoscopic tube may suddenly enters here, and this may make the injury to this pyriform fossa. So this is the danger site for the perforation. Okay, then during the swallowing, if ingested foreign bodies like the fish bones and some of the safety pins, they may get lodged into this space. So you are looking some foreign bodies here. This is one foreign body, and here some foreign body. Sometimes these foreign body may get lodged here, and they cannot be easily taken out by the cuffing reflex. Okay, then if they remains for the longer time, if they are not treated, then it is going to cause the injury to the internal pharyngeal nerve. Then it causes the anesthesia of the supraglottic region of the larynx. Okay, then even the cuff reflex also it is going to stop, and the foreign body it will remains there only. Okay, then and here in this condition you are looking here in the pyriform fossa, there is a growth is there. Okay, overgrowth is there. This growth, it is the malignant growth, that is a carcinoma growth. So what happened here? So because of the sufficient space, the growth is there, it is asymptomatic because it is not going to compress the side structure. When it is going to compress the side structure, then the patient feels some symptoms. Okay, until and unless the patient produces some lymphadenopathy, then only the person is come to know that one something, he approached to the doctor. Okay, then there we can diagnose with this endoscopy and other thing, there is a malignancy which is developed in the pyriform fossa. Okay, so this is all regarding the laryngopharynx. Okay, and another important thing we have to see that one, Walde's lymphatic ring. Okay, so for 2 to 3 minutes I will take a pause, sir. Hello,
Sir, okay, sir. Okay, sir.
okay. Hello, sir.
Yes, sir.
Audible now?
Yes, sir. Yes, sir.
Visible?
Okay. Yes, sir.
Okay.
Slide two, sir.
Yeah. Okay, so one important point here, the Waldeus lymphatic ring. Okay, so just while finishing the nasopharynx, oropharynx, and laryngopharynx, so we have seen some lymph nodes are there. So that is the tonsils we have seen. Okay, so they collectively, which are going to encircle the what communication between the what this oropharyngeal isthmus. Okay, this is the oral cavity, and here you are looking, this is the oropharynx. So the junction, this is called the oropharyngeal isthmus. In relation to this one, there are aggregations of the what tonsils are there. So those will be collectively called as the Waldeus lymphatic ring. So what are these we have to see? First one is right and left palatine tonsil, right and the left palatine tonsil. So the both side you can see. So usually what we call as a tonsils. So these are the palatine tonsils. Then posteriorly and above, so the nasopharyngeal tonsil. So that we have seen, that is as a adenoid. Okay, just we have seen the condition. Then laterally and above, on the both the side, laterally and above, there is a tonsils which are related to the what? Tubal, that is the auditory tube. So those are called as a tubal tonsil. Wait. Okay. So inferiorly, so which is related to the tongue. Here we can see that one another tonsil is there. So this is called as a lingual tonsil. So this collection around this oropharyngeal isthmus, they called as a Waldeus lymphatic ring. Then what are the structures of the pharynx? Okay, so we have seen that one, it is a muscular tube and it is situated behind these three cavities. Then what are the structures are there which making the pharynx? So first one is mucosa is there, then submucosa is there, usually what we will look at here. So then one layer which is making the main framework for this one, that is called as a pharyngobasilar fascia. Okay, I will show you here. So this is the base of the skull, From the base of the skull, the fascia is there, which is extending inner side of the pharynx. So this muscle we will call as superior constrictor. Just I will explain you. So it is running inside of this superior constrictor, which is going to make the fibrous sheet for this this pharynx. So that is the one structure. So that is the making the framework. Then another structures are there, that is a muscular coat. Muscular coats are there. So here we will get the two type of the muscle. One is the circular type of the muscle and another one is called as a longitudinal type of the muscle. The circular type of the muscles are there. Okay, those are the what? Outer layer. Those are making the outer layer. So those muscles will be what? The superior constrictor muscle. Then the middle, wait, I take pointer. Okay, so here you are looking here. So how this structure, we are looking from the posterior view and we have taken the section in the midline and we have reflected the left side of this pharynx. Okay, inside you are looking, this is a nasal opening, oral opening, and this is the larynx, and this is how the posterior view is there. So this is the pharyngobasilar fascia. Okay, then this is the superior constrictor muscle, middle constrictor muscle, and the inferior constrictor muscle. This inferior constrictor muscle is going to continue as a circular muscle of the esophagus. Okay, the three constrictor muscles are there. Next, the three longitudinal muscles are there. Namely stylopharyngeus. Just we have seen from the styloid process, which is going to the what? Pharynx. So this longitudinal muscle, it is called as a stylopharyngeus. Next one is solfingopharyngeus. Solfings is, that is here auditory tube. So from the auditory tube, the muscle is going to the what? To the pharynx. So that is the solfingopharyngeus. Next one is palate. We know that one, that is hard palate. From the hard palate, the muscle is arising, that is going to blend with this muscle only, that is the solfingopharyngeus muscle. So this muscle, so this you are looking palatopharyngeus. So you are looking, this is a solfingopharyngeus, small fiber. These two fibers unite and they are making the wall for this pharynx. Okay, so this is the muscle. So you may get the questions in your exams, that is what is the muscles of the pharynx. Okay, then Again, there is a lots of description is there regarding this muscle, how the muscles are arranged there. Okay, so I am going to brief out that one. So next, the nerve supply. Okay, so the pharynx is supplied by the what? Vagus nerve and the accessory nerves, the spinal accessory nerve. Then the glossopharyngeal nerve, it is also giving, and the superior cervical ganglion. Okay, so we know the sympathetic chain. So among that one, that is the sympathetic supply for the pharynx, it is through the superior cervical ganglion. Then the blood supply of this pharynx is through the ascending pharyngeal branch of the external carotid artery. We know that one, the external carotid artery, it is going to give the one branch to this one pharynx, that is the ascending pharyngeal branch, ascending palatine, and the tonsillar branch. Ascending palatine branch, then the tonsillar branch. So that is the branches from the facial artery. Facial artery, again the branch of the external carotid artery. Then dorsal lingual branch of a lingual artery. Okay, then greater palatine, pharyngeal, pterygoid branch of the maxillary artery. Maxillary artery is also going to give the blood supply. Then the venous drainage is into the internal jugular vein and into the facial vein. Okay, so this is all regarding the blood supply. Okay, so here we have finished the what? Pharynx. So in the pharynx topic, what we have seen that one, first where it is located, what is the dimension, then next we have seen the what are the parts, and we have gone through the each part of this pharynx, and we have seen the structure of the pharynx. Let me see the another complex structure, that is the larynx. Okay, so the last part of this upper respiratory tract. Okay, so what is that? It is the upper windpipe. The Latin word, the larynx, it is means upper windpipe. So this windpipe is going to join with the tube, that is the trachea. Okay, then this is also the organ for the production of the voice or the phonation. So this is here the vocal folds are coming. So because of the vibration of those folds, that produces the sound. Then it also acts as an air sphincter. Okay, so the air is going to enter into the what? The lower respiratory passage. Before enter, it has to cross this larynx, which will be acting as a sphincter. Okay, then the situation and extent. So where it is situated exactly? In the anterior midline of the neck. Okay, in the midline on the anterior aspect of the neck. Then it is going to extend from the root of the trachea. It is going to extend from the what? The root, sorry, not trachea, root of the tongue. So you're looking, this is a tongue, it is extending from the root of the tongue, and then it is up to the trachea. So only this much length is there. So this is the larynx. So in the adult male, it will be what? At the level of C3 to C6. C3 to C6, but in case of children and the adult female, it will be situated little bit higher level, that is C1 to C4 level. C1 to C4 level, that is the vertebral extent of this our larynx. Then what is the size? Okay, it measures about 44 mm, that is 4.4 centimeter, and in female it measures about 36 mm, that is 3.6 centimeter. So in the puberty, at the puberty, the male larynx grows rapidly. It's going to grow more rapidly than compared to the female. So it becomes larger. Okay. So it will shows the prominent angle of the thyroid cartilage. You can see that one, this prominency you can see in the what? Neck of the male individual. So that one, this is because of the rapid growth of this thyroid cartilage. You are looking at this, inside there is a thyroid cartilage is there, so that the anterior border is there. So this is going to join here, and that makes the prominency, though that is called as the Adam's apple. Because of this, the growth is more in case of the male. So the male is having louder and low pitched voice. Okay, but compared to the male, the females are having what the female is very negligible. Because of that, they are having a high pitched voice. Okay, then the diameter is there. So in the up to 3 years, the diameter will be 3 mm, and in the adult up to 12 mm. Okay, then let me see what are the structure and what is the by what structure this larynx is made up of. Okay, so the skeletal framework of the cartilages are there. What is the skeletal framework? That is the totally this larynx is made up of by the what cartilages. So these cartilages are there, they are joined here. So these are interjoined. Okay, we're looking, these are the cartilages are there. These cartilages are interjoined by the joints are there. In between there are joints are there, and these joints are binded by the ligaments and the membrane. Some of the ligaments are there, those are making the binding the joints, and the membranes also there, they are also binding this joint. Then these are moved by the number of muscles, so there should be the articulation is there. So that articulation, so with the help of the what, the motor function, so that is what, that is possible through the attachment of the muscle. So what the structures we are going to see here, the cartilages are there, these cartilages are going to be articulated with each other, then they forms the joint. Those joints are bonded by the ligaments and the membrane, and the movement is possible because of the attachment of muscles. These are all the structures which comes in the larynx. Okay, so the inner cavity of this is there. So this is lined by the mucous membrane. Okay, so let me see what are the main framework. That is the cartilages are there. Totally there are 9 cartilages are there. Okay, so the 9 cartilages, that is the 3 unpaired cartilages are there and the 3 paired cartilages are there. So let me see what are those cartilages. That is the 3 unpaired cartilages. So first one is the thyroid cartilage. Just we have discussed what we are looking here. This is the thyroid cartilage, which is shield shape. Then cricoid cartilage, just below this one you are looking here. This is the cricoid cartilage, which is in the ring shape. Then epiglottis is there. So you are looking the leaf-like structure. You are looking. This is the epiglottis, thyroid, then the cricoid, then the epiglottis is there. So these are the 3 unpaired cartilages are there. Then what are the paired cartilages? Paired cartilages are what? The arytenoid cartilages. So over this the arch here, the what arytenoid cartilage is here. Then corniculate, the small cartilage over here, the corniculate cartilage is there, and the rod shaped cartilage is there. So that is called as a cuneiform. So the 3 paired cartilages are there, means 2 in number. That is arytenoid cartilage, cup shaped, then corniculate cartilage, this is horn shaped, and cuneiform cartilage, which is wedge shaped. Okay, so let me go in detail of this thyroid cartilage. So which is looks like a V shaped in the cross section. Okay, when we take the cross section of this one, so it is V shaped. When we take the cross section, it will looks like a V shape. So it is consisting of the right lamina and the left lamina. There are 2 laminas are there, right lamina and other one is the left lamina. Each lamina is roughly quadrilateral, not exactly, these are roughly quadrilateral in the shape. And the posterior border of these, so you can see this is the posterior border, this is the posterior border, and this is the anterior border. These are far apart, means these are not joined like an anterior border. Okay, so the but anterior border you are looking here, these are going to join here in the male with the 90 degree. In the male with the 90 degree, because of that it produces the prominency in the neck region, and 120 degree in case of the female. That's the what how the angulation between the 2 laminas of this thyroid cartilage. Okay, then the lower part of the anterior border, now we are looking this anterior border, this is the anterior border. In the lower part, these are the anterior borders are fused and they are producing the laryngeal prominence. This is called as the what, the laryngeal prominence. Then upper part is that this is not joined. Okay, these are kept apart from each other, so that is produces the laryngeal notch. So this is laryngeal prominency. Then upper part is there, this upper part it is showing the what, the notch is there. So you can, if you put the neck region and if you hold the upper part of this thyroid cartilage, you can feel that notch. So this is the laryngeal notch. Then already I have told that one, the posterior borders are free and they are not joined. Okay, then these are prolonged upward. The posterior borders are there, those are going to prolong upward and in the downward direction. Because of that, those will be named, so those are called as the horns. Those are called as the horns. There is the superior horn and inferior horn. On the both the side, the posterior border is going to project above. This is called as the superior horn, and also on the downward direction, that is called as the inferior horn or the cornu. So this superior horn is there, which is going to connected with the greater cornu of the hyoid bone. So what you are looking, this is the hyoid bone. Okay, so this is the superior horn is there, which is going to connect to the what cornu. So sorry, hyoid bone, it is a greater cornu of the hyoid bone. So through the ligament, so this is called as the thyroid ligament. So this membrane you are looking, this is the thyroid membrane, and it is going to join with the thyroid ligament, the thickened part of this membrane. Then inferior cornu, you are looking here, this is the inferior cornu. So this is going to articulate with the cricoid cartilage. This is the cricoid cartilage you are looking here, and that makes a one joint. So that is called as a cricothyroid joint. This is called as what? Cricothyroid joint. Okay, then the inferior border, now we are looking here, this is the inferior border. Inferior border is convex in the center, in the front, or you can take a center. So then it is concave in the behind. In the front it is convex, and in the side it is concave, and it is connected to the cricoid cartilage. You are looking, this is the lower part, you are looking, this is the cricoid cartilage. So this inferior border, it is connected, so then it is by the conus elasticus. It is connected by the what? Cricoid cartilage by the membrane. So this is called as a conus elasticus. Okay, the outer surface, now we are looking, this is the outer surface. So outer surface, there is a tubercle is there. Okay, so that is called as a superior thyroid tubercle, which is extending from the superior corner and up to the middle part of this inferior border. So this here one what the prominency comes here, so which is going to give the muscle attachment like thyroid muscle attachment, sternothyroid muscle, and the thyropharyngeus part of the inferior constrictor. So these are all the muscles that takes attachment to this superior to the oblique line, so that is called as a superior thyroid tubercle. Okay, so this is oblique line is there, oblique line which is extending from the superior thyroid tubercle to the inferior thyroid. So exactly it is extending from the here superior thyroid tubercle, which is coming at the lower margin of the superior horn, and it is up to extending from the middle part of this inferior border. Okay, so that is called as a oblique line. That oblique line, it is going to give the muscle attachment, what I have mentioned here. Okay. Then the next cartilage is cricoid cartilage. So unpaired cartilage. So it is shaped like a ring. So you are looking at how the rings are there, ornament. Okay. So one end is narrow end, and another one is the broader. Okay, narrow end, and this is broader end. So the narrow end, how it is going to fix near the lower part of this thyroid cartilage, and the broader it is going to project here above. Okay, so that we will see here. So it is going to encircle the larynx. It is going to encircle the larynx, and below the thyroid cartilage. Below the thyroid cartilage, it is going to encircle. Means this thyroid cartilage is not completely circles this larynx, but this cricoid cartilage is there, it is completely circles. It is going to surround total larynx is there, and it is what? It is the foundation stone for the larynx. Okay, then it is thicker and stronger than the thyroid cartilage. It is thicker and stronger than the thyroid cartilage, and its anterior part is narrower. Anterior part is narrower, and that is called as the arch of this cricoid cartilage. Okay, arch of the cricoid cartilage, and the posterior part is broader one, so that is called as the, so you are looking here, this is projecting part like this one. So here you can see this is the what? The narrow end. So this is the arch, and here you are looking here the broad part. This is called as the lamina. Arch and the lamina, two parts are there. Okay, so this lamina is going to project into the posteriorly, it is going to enter into the what? Thyroid cartilage. Okay, and we know that one already. It is making a joint with the thyroid cartilage. So that is what? Making the joint with the cricoid joint. So cricothyroid joint. So this is cricoid cartilage and joints with the thyroid cartilage. So this is called as a cricothyroid joint, which is making with the thyroid cartilage. Then The next one is the epiglottis, last unpaired cartilage. So it is what you are looking at. This is the cartilage I am showing, which we can see from the behind how it will looks. If we look at from the above, so which is projecting above this hyoid bone. Okay, this is the leaf-like structure. So which is in the anterior part. So in the anterior wall of this larynx, in the upper part. Okay, so upper end is broad. It's upper end what you are looking, it is broader one, and the lower end is pointed. Okay, so which is directed in the downward direction. So the lower end is there. So lower end is our thyroepiglottic ligament. So it is pointed and it is attached in the angle between the right lamina and the left lamina. So here it comes the joining of the anterior border of the thyroid cartilage. At that junction it is going to attach here. Okay, here it is going to make another joint with the epiglottis with the thyroid cartilage. Okay, next one is arytenoid cartilage. Okay, these are what? These are the paired cartilages. These are the paired cartilage. I am showing you here. This is the cricoid cartilage. This is the cricoid cartilage. This is the arch, and this is the lamina. Okay, you are looking here. These are the two small cartilages you are looking here, which are situated at the upper part of this lamina. Okay, two small pyramid shaped cartilages are there. So which are lying in the upper border of the lamina of the cricoid cartilages. And the apex what you are looking, these are the curved, and these are directing the posterior middle. When you look at from the posterior view, then you can understand that one. These apex are directing on the posterior and towards the medial aspect. Okay, and the base is there. So this is called as a base, which is concave in the nature, and it is going to articulate with the lateral part of the upper border of the cricoid lamina. So this is the cricoid lamina. So in the upper part and in the lateral aspect of this lamina, it is going to articulate with the arytenoid base of the arytenoid cartilage. So this is the apex, and you can see this is the base. Okay, so this base is going to give the it is going to enlarge, or it is going to project in the anterior aspect and even in the lateral aspect. It is going to project in the anterior aspect and in the lateral aspect. So that prolonged anteriorly, so it is going to project in the anterior aspect. So that is called as the vocal process, and which is going to project on the lateral aspect. So that is called as a muscular process. Vocal process one, another one is called as a muscular process. So the surface is what we can say that one, that is the the anterolateral surface and medial and the posterior surface. There are three surfaces are there. Okay, next one is corniculate, the small two cartilage you are looking, which are above this arytenoid cartilage. So the two small conical nodules are there, which are going to articulate with this arytenoid. So you are looking, this is the lamina of the cricoid cartilage. Over this one, so the pyramidal shaped cartilages are there. These are the arytenoid cartilages. Up at the tip of this apex, over the apex, the another two small cartilages are there. So these are called as the corniculate cartilages. Okay, then next is the cuneiform cartilage. There are two small rod shaped cartilages are there. Then these are situated in the aryepiglottic fold. So where I have showed already. So just ventral to the corniculate cartilage. So this is what we are looking here. So I will show you. This is the arytenoid cartilage. This is the corniculate cartilage, and this is the cuneiform cartilage. Okay, so we will be having what we have seen the framework. It is made up by the cartilages, where we have seen the three paired cartilages and three unpaired cartilages. Other than this, we will be having some of the ligaments are there and the membranes are there. So that are going to make our joints are to be articulated here. So we are going to see the two types of the ligaments here. That is, the membranes are here. One is called as a extrinsic membrane, and another one is the intrinsic membrane. So one is the thyroid membrane, what we can see, and another one is the hyoepiglottic. Okay, so from the epiglottis to the hyoid membrane, so there is inside to this one at the anterior wall, another membrane is there, that is hyoepiglottic ligament, and another one is the cricotracheal. This is cricoid cartilage, and then extension is the next continuation is the trachea. In between that one, that is then the junction is there. So that is the cricotracheal ligament is there. So these are the ligaments which are going to connect these cartilages. Then intrinsically, so what we are looking here, there is a broad sheet of the fibroelastic tissue is there. There is a complete extension into the larynx is there. There is a sheet of a membrane is there. So depending upon its location, we can give the different name. So the part, so you are looking here this part. So what the part about the sinus caudate membrane. So this part, what you are looking, this one, this is called as the caudate membrane. This is called as the caudate membrane, and below you are looking here, this is membrane. This is called as a conus elasticus. Okay, so these are the intrinsic membranes. Okay, so again in the detail it is there, so I will skip here. Then cavity of the larynx. So this is some need is there. So what is that? The inside, how we can see what is the cavity, how it is formed. So it is going to extend from the inlet. So just I have shown this is the inlet of the larynx. So at the lower border of the cricoid cartilage. So it is what? Inlet, where it is lower border of the cricoid cartilage. We know that one. So this is cricoid cartilage, thyroid cartilage, and here the location of the cricoid cartilage. So it is what? It is placed obliquely. You can see. So in the pharynx only we have seen that one. The inlet, how it is what? In the oblique manner, and it is directing in the backward and the upward directions. Okay, and it is going to open into the what? That is into the laryngopharynx. Okay, the boundary I will show you here. Anteriorly, this is the cartilage. It comes as a epiglottis cartilage, and posteriorly, that is the interarytenoid fold of a mucous membrane. So here on the posterior aspect, the two arytenoid cartilages are coming, which are going to articulate here. So I will show you in previous slides. Okay, so here there is a arytenoid cartilages are coming here. In between that, there is a mucous membrane is there, interarytenoid membrane. So that is making the posterior boundary, the fold of a mucous membrane, interarytenoid fold of a mucous membrane. And on the side, it is by the aryepiglottic fold. On the side, it is by the aryepiglottic fold that is going to make the inlet of the larynx. Okay. Then within this cavity, okay, so the larynx, it shows that there are two folds of the mucous membrane is there. Okay, within this one, so you are looking, the two upper folds are there and the two lower folds are there. Upper folds are called as the vestibular folds, and the lower folds are called as the vocal folds. Okay, so the space in between these two, okay, the right and the left vestibular fold, the right and left vestibular fold. So this space is called as a rima vestibula. This space is called as a rima vestibula, and the space in between the two vocal folds, that is the lower folds is there. So that is called as a rima glottidis. So this is called as a rima glottidis. So the vocal folds are attached anteriorly to the middle of the angle to this thyroid cartilage. Okay, and the vocal process to the arytenoid cartilage. So this is how there are two folds I have shown you this one. So there is upper fold and the lower fold. So upper fold, those are called as the vestibular fold, and the lower folds are called as the vocal folds. So upper fold, in between that the space therefore is there. So that is called the rima vestibula, and the space in between the vocal fold, that is called as a rima glottidis. Okay. Then, so we are going to divide this total cavity of the larynx into the three parts. That is the supraglottic part, then glottis part, and the subglottis parts. Okay. So the part above the vestibular fold. So these are the vestibular fold. No, these are the vocal fold. The part above the vestibular fold, this is called as a supraglottis part. Okay, the part between the vestibular fold and to the vocal fold, so this is called as a sinus. Okay, are the ventricle of the larynx, the space. So the glottis part. Then the part below the vocal fold, this is called as the infraglottic or the subglottis part. Okay, so let me see somewhat regarding the blood supply and the venous drainage is there. So we have seen the vocal folds are there. Up to the vocal fold, it is supplied by the laryngeal artery, so which is the branch of superior thyroid artery, and superior laryngeal vein it is going to drain. Okay, the vein accompanying vein is there, which is going to drain into the what superior thyroid vein. So this is the what the level at the level of vocal fold. Then below the vocal fold, it is by the inferior laryngeal artery. Inferior laryngeal artery, which is a branch of inferior thyroid artery, and the same name of the vein and the same name of the veins are going to drain here, okay, into the inferior thyroid vein. Okay, then the nerve supplied to this larynx is motor nerve is recurrent laryngeal nerve and external laryngeal nerve. There's a vagus. Then the sensory is nerve is by the internal laryngeal and the recurrent laryngeal nerve. So these are the nerve supplied to this one. Okay, then the clinical correlation of this one, that is what the only few point I have covered here. Okay, so what you are looking, the larynx is the narrowest part of the respiratory passage. Okay, so above the trachea, this is located here. So this is here there is a chance of the foreign body is usually lodged here. Okay, because of the narrow passage. So usually in the pediatric condition, so they comes with the obstruction with this any foreign body in this region. Okay, then the inflammation of the larynx is called as a laryngitis. The itis is always what? It is a inflammation. Okay, then it produces the symptoms like hoarseness of the voice. Okay, then the laryngeal edema. So because of other condition, it causes the laryngeal edema. Then if edema occurs, then it is going to cause the what? Obstruction to the breathing. Okay, then the last condition we are discussed here, there is a laryngocele. Laryngocele, that is a protrusion of the sinus. So we have seen that one. This is supraglottic part and this is infraglottic part, and here you are looking, this is the sinus. Okay, this is the normal sinus, but you are looking that one, the sinus is extended beyond here. Okay, where if the air pressure in the laryngeal sinus is raised too much, okay, if it is continuously the pressures, like trumpet player, you know that one. So in in marriages and all that musical players are there. So those are always blowing the air to play this trumpet. Okay, and in the weightlifter, if they are holding the breath for a longer time with the pressure, then it produces the laryngocele. So that will produce, you can see that one. This is the nodal-like structure which comes in the neck region. So this is the laryngocele. Okay. So with this all, I have completed my topic. So if any doubts are there, you can ask.
Thank you very much, sir, for your practical-oriented speech on upper respiratory tract. Now, this session is open for discussion. Sir, there are few questions.
Okay, madam.
Okay. I will request Dr. Shrikant sir to ask the questions.
Yeah.
Over to you, sir.
Sir, good afternoon, sir.
Good afternoon, sir.
Sir, we have questions.
Yeah.
First question, sir.
Yeah.
After rhinoplasty,
Yeah.
is pattern of breathing changes or it will be remain same?
See, we are doing that surgery to make the what patency of the nostrils, is it no? So when we do the rhinoplasty, the obstruction is there. When the obstruction is because of the deviate nasal septum is there, then only we are doing the rhinoplasty. Okay, so it is we are doing the surgery to make the opening or to make the patency or the easy passage of the nose. Then it is not going to hamper the normal breathing.
Thank you, sir. Sir, next question.
Yeah.
So what is DNS? How it is affect breathing, and what is the reason DNS patient will affect with frequent cold?
What frequent? What, sir?
Cold, sir.
Cold, yeah. See, almost in the all the condition, this is because of the allergic condition. So in the DNS, deviated nasal septum, it is there because of the deviation. So what happens here? The nasal septum is going to deviate, okay, from its normal place. So the causes are what? The repeated exposure to the what? Allergic condition and the infection. So that causes the what? Inflammation. Okay, the mucus and submucus, those are going to inflame here. Okay, so pardon sir, what is the question?
Sir, what is the reason
Yeah.
in a DNS patient will affect with frequent cold?
Yeah, frequent cold. So actually frequent cold is there because of that is main because of the allergic condition. So that is going to cause the both inflammation to the septum and the running nose.
Thank you, sir. So next question.
Yeah.
So what is demarcation of olfactory region and respiratory region in the nose?
Demarcation.
Yes, sir. Yes, sir.
So exactly, we cannot demarcate with the exact boundaries. So we can say that one upper 1/3 is related to the olfactory region and remaining all related to the respiratory region.
Sir, thank you, sir. So next question.
Yeah.
Sir, explain about sinusitis condition and its method of treatment.
See, that is related to the medicine. Okay, even we can say that one. See, the nose is the what? It is a way where the air we take inside. So whatever the infectious organs are there, so the pathogens are there, those are easily they can enter into the sinus. So that is going to cause the inflammation in the sinus. So that is called as a sinusitis. And usually those are treated with the antibiotics like azithromycin, all the things. Okay, and even our Ayurvedic procedures are there, so those are also effective.
Thank you, sir. Sir, next question.
Yeah.
How to prevent epistaxis and how to manage sudden nose bleeding?
Yeah, so that is the question is there. Epistaxis is that is the nasal bleeding. So we can suggest we have to hold or compress the bleeding area. That is the main treatment, main line of the treatment. So in some other condition, we are going to give the medicines. That is the what to stop. That is to stop the bleeding, and some treatment also we are doing. So exactly that you are going to study in the final year in the Shalakya Tantra.
Thank you, sir. So next question.
Yeah.
Is there any treatment for adenites and what are they?
Yeah, adenites are those. Why? Because of the infection. So if you correct that infection, that it is going to cover. So if it needs, then we are going to enter with the surgically. We are going to remove that gland.
Thank you, sir. So what is the importance of Walde's ring?
Yes, Walde's ring. See, so at the oropharyngeal isthmus, this is the aggregation of all the lymph tissue is there. So that is going to prevent it from the it is going to trap the our infections. What are entering? One thing is there. So that is arrangement. The lymphoid tissue is there. The tonsils are there. Okay, so those tonsils are making our part of the immune system.
Thank you, sir.
Yeah.
Sir, what is the smuggler fossa and why won't damage any structures in when you're keeping the things?
Why?
Why it won't the fossa won't damage it by keeping any things for a longer period?
Yeah. That point I have left. I think smuggler fossa is nothing but the piriform fossa where the smuggler used to carry the things. Okay, so those are the normal passages are the fossa of our body. Those are definitely going to cause the damage. Okay, so that is not worthy to them because the money is more worthy to them.
Sir, thank you, sir. This is the question. Thank you so much, sir.
Okay, sir. So shall I end the session, sir?
Thank you, sir.
Okay.
So everyone got your doubts clearly. And now it is the end of the session. Before that, I would like to request Dr. Shrikant sir for a vote of thanks. Over to you, sir.
Thank you, ma'am. I would like to thank our management team, of our college and patron of this webinar, Shri DC Patil Sir, Chairman, Grameen Ayurvedic Medical College, Terdal. Dr. JB Algur Sir, Secretary, Grameen Ayurvedic Medical College, Terdal. Sri Nilesh J. Desai Sir, Treasurer, Grameen Ayurvedic Medical College, Terdal, providing great opportunity for this webinar series. On the behalf of Institute, I thank to our chief guest and inaugurator, Dr. Prasanna and Rao Sir, Principal, Sri Dharmasthala Manjunatheshwara College of Ayurveda and Hospital, Hassan, Karnataka. I want to thank our beloved Principal Sir, President of this webinar, Dr. L.M. Beledar Sir, for his presence and delivering keynote address. I would like to thank our organizing secretary, Dr. U.P. Patil Ma'am, Associate Professor, Department of Rachana, Shareera, Grameen Ayurvedic Medical College, Terdal. I would like to thank today's guest speaker, Dr. Shankarling Maidargi Sir, Associate Professor, Department of Rachana, Shareera, SVM Ayurvedic Medical College, Hospital, Research Center, Ilkal, Karnataka. I like to thank all the members of organizing committee. I would like to thank our teaching staff, non-teaching staff, hospital staff, and students of Grameen Ayurvedic Medical College, Terdal. Lastly, I would like to thank all the media personnel, faculty members, practitioners, UG students, PG scholars of different colleges, and audience from different parts of the country. I like to thank our principal sir, organizing secretary, management of Grameen Ayurvedic Medical College, Terdal, for giving me an opportunity for the vote of thanks. Tomorrow we will meet for the second day session of the webinar on anatomy of lower respiratory tract and its clinical anatomy by Dr. Girish Kulkarni sir at 10 a.m. tomorrow. Lastly, I mentioned a special thank to our beloved chairman sir, Sri DC Patil sir, for spending his valuable time with us. Thanking you one and all. Kindly subscribe our YouTube channel for more updates and regular webinar series. Thank you one and all.